y'all. I'm gonna be here to try to persuade y'all why to try hyperbaric therapy. Hyperbaric oxygen therapy is administered in a single and multi-patient hyperbaric chamber that delivers 100% oxygen to the patients in an environment to increase atmospheric pressure. Hyperbaric therapy works throughout your entire body as an increased level of oxygen enters the bloodstream and body tissues. Types of effects of hyperbarics has on patients. You got your bubbles in the oxygen, your bubbles under the skin and the oxygen. You got your mass washout, your anti-ischemic, your antibacterial, your vasoconstriction, your pressure, that's your bubble reduction. Elevated chamber pressure reduces size of any tapered bubbles, oxygen solubility in plasma. Oxygen is dissolved in plasma. Oxygen in plasma is used more readily than what is bound to hemoglobin, leaving hemoglobin fully saturated on venous side. Blocks O2 transport by hemoglobin. Okay, I was telling y'all about the bad trauma with the ears. This is your ear canal. If you get bad trauma, you can get ear tubes put in. Everybody know them as PEs. The PE tubes. That helps, that oxygen, that helps your ears pop by itself. You ain't got to worry about it. Normally what we see when we say bad trauma is we see that the ear do like a bubble gum. Because when we look inside the canal, it looks like a big inflamed bubble. Well, we offer the PE tubes, is the passage of air into the middle ear. The edema, the mucus, and the other materials in the lunar alteration in function of muscles can prevent the equilibrium. Procedures to prevent bad trauma will be covered in chambers operations. Round window blowout, sinus sneeze, dental and teeth squinch. That's this. Holding your pressure on your ears to make them pop. You're chewing gum, that makes your ears pop. And I see some patients and that helps them clear their ears just fine. And yawning. Like that, make that whole jaw muscle move. So it's very easy to make your ears pop. Visual refraction changes occurs more than after 30 treatments. Refraction changes in your lens. Like I said, we ask people not to change their prescription on their glasses because your vision will come back. But we all, we know about this, so we tell all this up front, so it won't just be a slight, so it won't just come all of a sudden to somebody like, oh, I can't see. No, you can see, and no, your vision is not getting worse than what it was. It's just a little delayed. You might get a little numbness in the fingers. Diabetics normally have that. They get to numbness. Confined anxiety. We actually give medicine for confined anxiety. We give medicine like Xanax and Ativan, and we actually give pain medication too. If the patient have pain because they're laying in a tank so long, we can give them pain medication before. The doctor will prescribe it. They'll take it before they come. Pulmonary oxygen toxicity. Some people do get too much oxygen and they get toxic. That's when we stop, we run the proper test. We always have a doctor in the hyperbaric unit. We are owned by 9 different doctors. So we only dive on 6 days. We dive on 7 days only for emergencies. Signs and symptoms of the toxicity is respiratory manifestation, sensory manifestation. Because we don't see too much of the toxic. People don't get toxic with the oxygen, I guess because they need it so much. Okay, we always ask before we start anybody in the tank, do you have any uncontrolled fevers? Do you have any seizures? If you have uncontrolled fevers, that means that the seizures can be aggravated by the fever. And fever brings on seizures. So, we actually, and we give medication. Sometimes we'd rather not dive somebody if they have seizures, because actually in the tank is the best place for them, because you're actually supposed to sit on your hands if somebody is actually having a seizure, not trying to stop them or anything. You don't touch it, you just let them be. So if somebody's getting 100% oxygen and they are in a tank, you just let them be. You don't even turn the machine down. You just let it go. After they seizure cease, after they seizure stops, then you start turning them down to get them out there to see how they're doing. But they're in the best place at 100% oxygen. Even if somebody is going into a heart attack, they're in the best place under 100% oxygen. Well, hyperbarics is just one thing that everybody tries. They get and they look at the tanks and they're like, oh no, I couldn't get in that. It looks like a coffin. But hyperbarics change and help save so many lives. I done seen people with bilateral amputations that if they wouldn't have got that amputation and hyperbarics, they wouldn't have lived. I done seen people that died that refused to get in the tank 3 times as fast as a patient that got in the tank, had the same thing, and decided to do hyperbarics. We deal with the phases of treatment. You just gotta watch that. Now the problems you can get from HBO, I said about the barotrauma, the vision, the numbness, the confined anxiety, the hypoglycemic seizures, the pulmonary oxygen, the CNS toxicity, the human research and pressure, signs and symptoms of oxygen toxicity, the rationale for hyperbarics treatment of various diseases. Introduction. Hyperbaric oxygen, HBO, shown to be very vulnerable as an adjacent treatment. HBO therapy treats of choice for a few conditions. Gas gangrene is one of the biggest ones. We save a lot of people's lives and limbs with gas gangrene. We save a lot of people's legs with compromised flaps. Infection, we got necrotizing infection, we got necrotizing fasciitis infection, an infection that hits the skin, takes the person's body and just run with it. Hyperbaric actually stops it because your body just in open air cannot stop that infection. Hyperbarics we treat a lot for osteomyelitis. That's a bone infection. That's one of the biggest things we treat for too. It helps prolong a person's life. We do a lot of radiation treatment for radionecrosis with hyperbarics. And that's a little bit it. I just got a couple of pictures I want to show y'all of the rationale for hyperbarics. This is how like infection sitting under the skin, showing a little bit of gas gangrene. Gas gangrene is a bad infection under the skin, and it's gas and it feels like bubbles. And you can take a person to surgery, and that doesn't mean that you're going to cure it. This is what we hear. This is like a compromised flap. Like somebody cut off their finger and they put it back together. That's a toe. This is that necrotizing infection. On the legs, infection just take off all that skin in the legs, on the legs. And this is that necrotizing fasciitis. It just like take one big part and just eat it up all the way down to the muscle and bone. This is some diabetic wounds. This is somebody on steroids which you would not try not to do a debridement on. You wouldn't try to take the surgery. So you'll want to push 100% oxygen, hoping that it would help them.